Today, let's talk about prognostic factors in young patients with ST segment elevation, myocardial infarction. The prognostic factors of young patients aged less than or equal to 40 years with ST segment elevation, myocardial infarction remains unclear. This study explored risk factors that may affect the 1 year prognosis of young ST segment elevation myocardial infarction patients by analyzing patient data of baseline, clinical regime, and secondary prevention. The method includes baseline and clinical data were collected from 420 STEMI patients aged less than or equal to 40 years. 1 year of follow up was performed to record and compare the differences in data between patients with and without adverse events. Binary logistic regression analysis with controls for confounding factors was used to evaluate prognosis-related independent factors. Coming to the results, the overall incidence of cardiovascular adverse events was 15.95%. Comparison of the subgroups revealed that regardless of adjustment for confounding factors, prognosis of the patients were affected by the following factors: BMI, marital status, serum apolipoprotein levels, number of deceased vessels, treatment regime compliance of secondary prevention, improvement of lifestyle, and adjusted comorbidities. Independent analysis of adverse events revealed that BMI, number of deceased vessels, and compliance of secondary prevention were independent factors of recurrent acute myocardial infarction in patients. Serum apolipoprotein level, treatment regime, and compliance of secondary prevention were independent influence factors of heart failure in patients. Marital status and serum apolipoprotein level were independent factors of malignant arrhythmias in patients. BMI, compliance of secondary prevention, and improvement of lifestyle were independent factors of cardiac death in patients. To conclude, the study determined the influential factors for the prognosis of ST segment elevation myocardial infarction patients aged less than or equal to 40 years as follows: BMI, marital status, comorbidities, number of deceased vessels, regime, compliance of secondary prevention, and improvement of lifestyle. The risk of cardiovascular adverse events may be reduced by modulating the influential factors.